This is such a systemic problem that, I'm going to tell you a story, and this is true, and it's embarrassing, but I think it needs to be said because I think it really highlights how women are treated in medicine. When I was in training, we had these upper level residents. So we have a hierarchy where you have different years of training. So I was in the early years, maybe my first year, and we had these clinics that we would run to take care of patients. And so we have obstetrics and we have gynecology as like divisions in our training. So in gynecology, everything gets lumped together. Pediatrics, menopause. We had no specific menopause clinic. I maybe got 6 hours of lecture in a 4-year curriculum. And so we'd have these women coming in midlife, and they had multiple complaints. They didn't feel good. They weren't sleeping. They were gaining some weight. They were, aching. They, just this laundry list of things that were a little on the vague side. And my upper levels would say, oh gosh, good luck with that. You've got a WW on your hands. And that was code. We never wrote that in the chart. This was not taught to me by faculty. This was just kind of a handed down in the lore of training. And a WW was a whiny woman. And that was code. And now I know that she was perimenopausal, suffering from her list of symptoms, of now which we've categorized about 70. And they were frustrated because they didn't think they could help her. Now remember, the Women's Health Initiative, which was a study that was supposed to do a lot of good for women, it was originally designed, and it was stopped in 2002. That was the end of my training program, was 2002. So I come from one of the last groups of physicians in the U.S. that were ever trained in hormone replacement therapy, and then the rug was pulled out from under us. So the WHI, there were mistakes, there was misinformation in the reporting, and there was misinterpretation of the results. All of that has been walked back, re-looked at. We know that for the vast majority of women, hormone replacement therapy is safe and effective and can give a woman her life back if she chooses to take it. But that option has been taken off the table for the vast majority of women. Recently, I just saw the numbers. 85% of women will come in complaining of what we know now. This was in 2023. FDA looked at the numbers. 85% of women are complaining of menopausal symptoms.